Welcome back to Her Time, Her Health with me, your host, Dr. Jila. Today's guest, Sammy Tejada. He's an author, he's a leader, and he's the founder of Liquid Vita wellness centers here in South Florida and nationally. He's known for his work in hormone optimization therapy, anti-aging, and regenerative medicine approaches, and his focus on personalized wellness protocols for metabolic and hormonal health. He's a wealth of knowledge, and he's somebody that started as a firefighter, EMT, and saw what was happening to his patients when he was picking them up and realized that there is something called preventative medicine rather than reactive medicine. And that was the aha moment for Sam. So today we're going to dig in to Sam and his journey and what drives him to where he is now. Today I have Sammy here with me, Sammy Tejada. You know, I'm really happy that you made it down, and I appreciate you for making the time to be here and to speak to the audience. I want to start with, who was Sammy Tejada before Liquid Vita? I want to start with your journey and how we got to where we are today.
Oh, Sammy Tejada before Liquid Vita. So that was the guy that really was trying to figure himself out to have that most rewarding job. And that Sammy Tejada was firefighter-paramedic Sammy Tejada, who worked for in the world of emergency medicine here in South Florida. I worked for Oakland Park Fire Rescue in Broward County, and I did that for 12 years. I started in the fire department when I was 20, retired when I was 32. And the reason I retired is because Liquid Vita took off. Now, Liquid Vita, I started it while I was in the fire department because we have these unique schedules that we work 24 hours on, and we're off for 48 hours. So I started Liquid Vita when I was 26 years old. And throughout my tenure in the fire department, you know, I really started realizing where my God-given passion should go, right? And that God-given passion of helping people was not that quote unquote hero job, being a firefighter paramedic. I saw a whole nother side of medicine on my days off from the fire department. Not when I started Liquid Vita, but prior to that. So at the age of 20, when I started at the fire department, I also got a part-time job for my days off with Dr. Robert Willicks, which I actually dedicated my book to him after he passed away right before COVID at the age of 80. So Dr. Willicks was a world-renowned heart surgeon who decided to leave heart surgery to prevent patients from going on the operating table. And what I was doing on my days off from the fire department, I was actually his blood guy, his phlebotomist. So he was the chief medical officer of a company called Cenegenics.
Okay.
So Cenegenics was one of the pioneers in the longevity space, really heavy focused on diagnostics, right? DEXA scans, VO2 max, comprehensive blood work. And when I started actually going to Dr. Willicks's patients to their homes, I would go there every 3 months, right? To get their blood work, their follow-up blood work. And I saw people changing their lives. And some of his patients were patients that were standing on their last leg. I mean, patients with autoimmune issues, cancer, you name it. And I saw Dr. Willicks reversing disease. Where on the other side, when I was going to the fire department, you know, when you work in a municipality, you get to know these residents very well, right? Especially the ones that are the frequent flyers that are going to the hospital. And what I was seeing year after year is that these patients that we were transporting to the hospital, they were getting worse. Their health was circling down the drain. They were being put on more medications while multiple doctors are seeing these patients. They're not communicating amongst each other. The medications was like a grocery bag full of medications that the patient didn't even know what they were taking, you know, 20 plus medications. And I was part of that journey from the first time they would call 911 all the way till the day that they'd go into cardiac arrest and die, you know, because obviously the family members, they call us 911. So it got to a certain point where I told myself, I said, you know what? God has shown me over these last 12 years that where I need to actually be is on this side of medicine, which is the functional medicine, integrative medicine side of it.
Mm-hmm. The prevention rather than
prevention,
the reaction
right.
later when the disease hits, right?
Yeah.
Tell me about the creation or the evolution of your journey with Liquid Vita. How did that, you saw what was going on. So then what made you decide, okay, you know what, I'm going to go into this and I'm going to create something?
That's Liquid Vita wasn't a full longevity center like it is today. And the opportunity for Liquid Vita where it started was, Dr. Willick's, his longevity clinic was more focused on the functional medicine side when it came to like hormone optimization, nutrients optimization, things of that nature. So what I ended up doing, one of the patients, when I went to go draw their blood, his patients were some of the wealthiest people on this globe. And, I had one patient initially that told me, it's like, hey, when I go back to my house in California or Colorado, I typically have a off-duty firefighter-paramedic do these vitamin IV infusion drips on me, which I feel fantastic. Then I had a second one of his patients tell me the exact same thing, and then a third and a fourth. By the fifth one, I said, what is this IV vitamin therapy stuff they're talking about? And they all were saying that it's an off-duty firefighter-paramedic doing it. So started looking into it. What was hopefully soon to be my competitors, which a lot of them now are my customers. And I saw what they were doing and I found it very interesting. Started listening to a few doctors on like YouTube talk about it. Dr. Mitch Genn, who has a chapter in my book as well. And I told myself, I said, man, I see what these other clinics are doing in California and in Colorado also. I can do what they're doing, but I can do it better.
Right.
And I can do it in a setting that's more inviting than a clinical hospital type of setting. So that's how I got into the longevity space. I actually took a leap into it. I talked to Dr. Willicks and he says, oh, this is great. I was doing IV therapy many years ago, but people really didn't accept it, and Dr. Willicks has been in longevity for so long. Of course, he's done everything. But once he gave me his blessing, I saw that there was an opportunity there and I launched Liquid Vita with $500 in my back pocket.
Wow.
And I had the right people around me to give me the support. And fast forward, we're almost like 14 years later, now it's this multi-million-dollar company with longevity centers all throughout the nation. We're on the pharmacy side, one of the largest distributors of the IV therapy product to over 5,000 doctors nationwide. We have one of the top leading health and wellness podcasts as well, A Healthy Point of View. And then we have our conference, which is called the Vitamin Infusion Business Expo, the largest one in the world, which I'm one of the partners of and also the host of it. And then I was appointed as the chairman of the American IV Association, which we focus on a lot of the regulatory issues, so standardization and compliance. And it's an industry thing where, a lot of the industry leaders are part of this association.
Wow. Yeah, you started with firefighting and being an EMT, and here we are, right? Did you ever really think as a founder, entrepreneur, that this is the trajectory of your career when you were 20, 21 years old?
No, actually, you have no clue where it's going to go, right? I'm a visionary, so I always kind of like, I'm a dreamer. I kind of like see things, how they how it can happen. But so many other factors play a part throughout the growth, portion of your business. And, you learn so much throughout the process, but I had no clue that I'd be where I'm at today.
Yeah. Right. If someone told you, you'd be like, yeah, I don't know about that, but
yeah, pretty much.
Pretty much. Let me ask you something. You are in the health and the wellness space completely. And how do you decide what trends, like health trends, are worth investing in and which ones are like just hype?
Yeah, when it comes to like actual trends, I try to stay away from trends. When it comes to our clinical team, our chief medical officer, and then the rest of our doctors, and we're looking at what to implement, it's all based off of data. We try to look at the science, what's happening. Now, there are certain technologies that are very early on when it comes to the science and the data, but some of the things that we see with our patients by utilizing some of these technologies show that it's pretty promising. So we do implement it and then watch it closely. But it's not, for us, it's not just about the trends. It's really about the science and what it's doing to your actual biology.
Right. And the outcomes that your patients are seeing.
Yeah, absolutely.
Yeah, you follow them. So I'm going to dive into some women's health stuff, which we have spoken about some of this before. Women tend to spend about a third of their lives post-menopause. Yet a lot of them are being dismissed and they don't feel their best. And most women, if they do nothing, in terms of longevity, they spend their extra years in poorer health. How do you think, the way the industry is going with wellness and everything, how is that being changed and looked upon now?
So I think there's a huge shift, especially with physicians like yourself, with so much experience going into the preventative, proactive side of medicine, and creating your own longevity centers to really help people optimize their health. So, and then also when it comes to policies, right? Recently, they took the black box warning away, which that was something that was, I think, restricting a lot of women. And when we're looking at the traditional allopathic world of medicine and looking at, their family doctor and how they're treating them, they've been very hesitant to even touch it, right? Because of that. And I remember when Dr. Marty McCary, announced it that they're removing it. For me, that was a big relief for the women because, women have been at a disadvantage when it comes to a lot of this functional or integrative medicine. And, historically, I've been in it since I was 20. I'm almost 40. So 20 years I've been in this longevity space. And I'll be honest with you, it has been male driven. It's been primarily for men. And it's been primarily for white men, here in the United States. And that's one thing that I'm very eager to see the change and see it be more diverse to not just older white men, but, women and then men of color as well, too, for people to truly take control of their health.
I primarily take care of women, 25 years as an OBGYN, and now more on the women's health side of things, because again, we see a disconnect and we see women being dismissed and no one's helping them. So I'm like, okay, just like you, I'm going to create it. We don't have it. There's a missing piece. We're going to create it. In terms of, when you think about longevity for women, what does it actually look like? Like when women come to you for, I want certain things and I want to live longer and I want to be healthier. How do you approach these patients or this subset of your clients?
The first step is open up our ears. We have to listen, and, when we're comparing women to men, women are a heck of a lot more complex than dealing with men and their hormones. And, women are going through these different stages, the different cycles, if they're perimenopause or if they're menopause, postmenopause, wherever they're at, the first step is we have to listen. Could be so much going on. So lifestyle assessment and questionnaire, going deep to really understand how they're living their life, how they're sleeping, all the other lifestyle factors, what they're eating every single day. Are they working out? How do they feel fatigue? Look at all the different symptoms that they potentially might be having. And then from there, we go into the diagnostics to then take that deeper dive and get a good bird's eye view. But for me, the most important part is listening. You have to listen to what's going on.
When I see patients or when I'm out at conferences speaking, things like these engagements, you see women, now they're hearing and now they're understanding. And then they feel seen and they feel, okay, I'm not alone in this journey. It's happening to everyone else, because I think a lot of women feel isolated.
Right.
And it's like, this is taboo. We can't talk about this because it's bad. But when we have these conversations, they're getting the, okay, it's fine. We can fix this. There are things that we can do and you will get better.
Right.
So I think it's shifting by all of us coming together and kind of really putting the information out there where they're like, okay, there's somewhere to go. There's someone who's going to help me and not just dismiss me and make me feel like it's all in my head, basically.
Yeah.
Right.
Yeah.
Talk to me about peptides, GLP-1s. How do you have that conversation with your patients when they come in?
So our thing, so we utilize the GLP-1s. We've been using it when the first few ones like semaglutide came out. And, obviously they've advanced with a few of the other new GLP-1 drugs that are out. And for us, the first step we like to tell our patients is that this is not a crutch. This is going to be a tool to kick off your weight loss journey. our goal is for them not to be that on that medication
Dependent.
long term.
Mm-hmm.
And one of the most important parts when we actually utilize any kind of GLP-1 drugs is making sure they're losing the appropriate kind of weight.
Mm-hmm.
Because as we know, we've heard it all over the news,
Right.
people are losing the wrong kind of weight, muscle weight, right? And that lean mass, when we talk about metabolic health, when we talk about longevity and health span, it's important. It's one of the most important things that we talk about in the longevity space.
Mm-hmm.
So if you're losing muscle mass, it's counterproductive to what we're trying to achieve.
Yeah.
So we do a DEXA scan for body composition analysis.
Okay.
So we get that baseline, and then we trend their weight loss journey, utilizing those type of tools like a DEXA scan or an in-body. But so not all patients are going to utilize the exact same dosage when it comes to the GLP-1 drugs. Our doctors are very fond of microdosing the GLP-1 drugs and not going to these aggressive dosages, right? And then the most important part throughout that process is actually lifestyle change, which moving your body is extremely important. So we want to make sure that they're getting their steps in, that they're exercising, they're doing some kind of strength training and conditioning. We want to make sure that they're eating the correct amount of food. So we're looking at what their calorie intake should be. We do a test that's called resting metabolic rate. So we could kind of target based off of what their resting metabolic rate is, their nutrition when it comes to macros and micros. And then also looking at the supplementation to make sure we supplement them with the right nutrients, vitamins, minerals, and amino acids as they're on this weight loss program that we establish.
Yeah. It's quite comprehensive what you guys do. Yeah, I've had a few patients go to Liquid Vita, and the reports, the results are just insane. And they've been like taken care of from like head to toe, basically. So it is something that I highly recommend our audience looks into and takes into account, because like you said, you're all over the nation now. So they can find one close to them and go and check it out. Tell me about, I was interested about your event. Tell me a little bit more about that.
So when the industry started getting together, the IV therapy industry started to get very regulated between the individual states. Right. And the reason why is when there's any kind of opportunity in the medical business where people can make some cash, you get a lot of bad actors, you get people that are cutting corners, and then you get a lot of medical providers that are doing things and they just don't know that they're doing it incorrectly or not following the appropriate guidelines. So we've started getting heavily regulated by the different governing boards, medical boards, the different agencies with the 3-letter words. So that's where Jeff Cohen, who's a leading healthcare attorney here in South Florida, he saw that there's this uptick on a lot of things happening in the industry on the legal side, where he decided to put the American IV Association together. Okay. So him and his CEO, Autumn, they launched the American IV Association. And for about a year and a half, the association wasn't really gaining much of momentum. And then we were all at a conference, all the CEOs, we were at an IV therapy conference. Back then it was called IV Biz Bash. And we all sat down together and we said, that association really needs like a leadership advisory board, a scientific advisory board. We need to really come together and make this association into something. So Jeff Cohen loved the idea. So we got all of the chief medical officers to create the scientific advisory board. And then a bunch of us CEOs that are leading the industry, we created the leadership advisory board. And then lucky me, they appointed me as the chairman. There's like, Sam's already all over, social media, this, that, but become the chairman. So I got appointed as the chairman. I embraced it, because I'm very passionate about the IV therapy space. And then, as we're thinking through it, we says, just like any other association or industry, we should really put a yearly conference together. So we put together the VIBE conference, which stands for Vitamin Infusion Business Expo. And the purpose behind the conference is just bringing a lot of experts from the industry to get on stage, educate on the different modalities that are specific to the IV therapy industry. So everything from EBO2, ozone, NAD, the new NR IVs, the different protocols for high dose vitamin C. We bring in pharmacists that are running the 503As and 503B pharmacies, talk about some of the regulatory issues. We bring a few attorneys as well. And it's just so much very informative type of information that we're giving all of the providers that come to the conference. So this is going to be our this is going to be our third year doing it. And we're excited to see where it takes us. You know, this year it's going to be October 9th through the 11th in Las Vegas at the Caesars Palace. So we're shooting for about anywhere between 2,000 to 2,500 medical providers there on site. And we have some amazing speakers for this year. Yeah.
That's amazing, because, you know, the thing is, there are all different kinds of wellness expos and things like that happening. But when you have something credible with credible sources there, I think that is what differentiates one from the other.
It is. Yeah.
And it actually helps drive healthcare in the right direction with the right supervision and the right guardrails in place, I think, right? Like you said, there are people using IVs, but they don't really know all the nuances that can go on with that. And with your kind of conference and your oversight, you're giving them that information. That way it's safer for patients altogether.
Yeah, and this one is a niche too. Even though we talk about a lot of things that are complementary to IV vitamin therapy, you know, for us, this conference is hyper focused on anything that's going into the vein. You know, so we do bring in doctors that have their longevity clinics that do all of these other type of services and modalities, but you know, we want to just focus on everything that's going into the vein in this conference.
Yeah, I like that. So I want to talk about, you know, how do you balance your own health with all of your other entrepreneurial activities and podcasts and things that are going on? You know, how do you maintain your own health? How do you put everything that you know into effect for you?
You know, my mom asked me that question just a few days ago, and I told her, says, Mom, you're lucky I didn't join the circus, because I do a lot of juggling to try to figure that out, especially with the traveling, you know. And when you're talking about really biohacking and taking care of your health and leading by example, you know, you want to make sure you're working out, you want to make sure you're eating the right foods. And when you're traveling, that's not the easiest thing to do. And one of the things in the longevity space that we talk about that's extremely important is sleep. Right. So when you're going to these different time zones and you're traveling and you got to be up the next day, sleep goes off, you know, a bit too. So I'm very data driven. So I'm always wearing my wearables. I have my Oura ring on right here. So I use that as a tool. I always say you can't improve what you don't measure. So I'm consistently measuring to make sure that if I am going out of range, I start taking away from elsewhere to make sure I subsidize my health with whatever is needed, with more time or whatever. So that's one thing that's extremely important. I always try to keep myself on track when it comes to making sure I'm moving my body, regardless if I don't have my nice Lifetime Fitness gym that I have access to, even if it's a small gym, or if I just go outside and just go walking or a little light jog, I make sure I do that. And then just making the healthy choices when it comes to the different options that I'm eating.
Yeah. Putting all the basics into place, even though if it's maybe hard when you're traveling, you're still making sure that you do as much of it as possible.
Yeah, and when I'm here at home, then I can really get into my routine, which I have my set routines that every morning I wake up and I do certain things. So
yeah, tell me about your routine now that you went there.
Yeah, so you know, every morning I have my routine, and I really don't like to be distracted out of that routine. And you know, sometimes I get that phone call, or maybe sometimes the day before, my assistant tells me and says, "Hey, is there any way that we can sneak this person for 30 minutes? We really got to get this conversation going." I'm just like, you're killing into my health routine here. But that morning routine, first thing when I wake up, I don't wake up to an alarm clock. So I typically only get about 5 to 5.5 hours of sleep, right? Which most people think that's kind of crazy. But I prepare my body to go to sleep. So I make sure I don't eat about 3 hours before going to sleep. And then I naturally wake up. I usually have the blinds a little bit open so natural sunlight comes in. And once I wake up, the first thing I do is I just go outside. I go out by the pool area, try to get some of that natural sunlight. And then after like an hour of waking up, I get on my my vibration plate. So the vibe plate, helps get that blood flowing. I do have an infrared sauna as well too. I don't use that every single day, but sometimes I jump in there. I have a few different peptides that I like to use. One of the ones I use every morning, which is my favorite supplement that I use, it's a nasal spray, and it's called a Synapsins. So the Synapsins nasal spray has 3 natural ingredients. It has the methylated version of B12. It has RG3, which is the potent extract of ginseng. And then it has NR, which is a precursor to NAD. And this nasal spray, when I do it every morning, it puts my whole life in high definition. I hear better, see better, speak better. Everything's just like sharp as a tack. So I do that. I have my certain supplements that I take during the day and also at night. And then from there, some mornings I'll go out rucking. My wife and I, we love to go rucking where we wear a weighted vest. I wear 40 pounds. She does 25 pounds. And we have a beautiful park in close to our neighborhood. So we go out there for about an hour, just walking. And sometimes when we're rucking, we'll take Zoom calls or phone calls, but we're getting our movement in. And then I try to make it to the gym about 4 to 5 times a week. And that's where I do my weight training. So I do work out full body every day that I work out. It's full body. I don't focus on just body parts how I used to do in my early 20s. For me, it's my main focus. Everything I do, especially with my workouts and stuff, is number one, I don't want any injuries. So those CrossFit days, those are done. And then number 2, I'm just looking for longevity and health span. That's it.
Yeah. That's an amazing routine. I like that. And I have recently started the rucking, and I like it. Yeah, with the 25-pound vest. And it makes it easy because I have 2 big golden retrievers that we need to walk.
Oh, nice.
And so I put on my weighted vest and I go rucking with them. And sometimes, one of them, he's more rambunctious. So like we do a light jog as well. So yeah, we're getting in the movement. I like it. I love that.
Yeah, there are a few other things that I'll throw in there that I'll mention. I'm big into meditation. So I utilize a device called Brain Tap. Dr. Patrick Porter created it. So that I don't do every day, even though I'm trying to be a little bit more consistent. I just don't have enough time to do everything I have access to, right? And then I also have my vagus nerve reset device. I have a pulsetto that I utilize as well. So
yeah. How do you like the pulsetto? Tell me about that.
Initially, I got it about a year ago, and I really didn't know much about it. And I was experiencing at that point in time, I was experiencing these almost like small little syncopal episodes that I didn't know what it was all about. So I got with our chief medical officer, Dr. Christopher Davis, and I told him, I said, Doc, I've worked many years in the fire department. I don't know what's going on, but I hope it's not something wrong with my heart. He's an interventional cardiologist, so I want him to, figure out and check me out. So he put me on the Max Pulse machine, and he started looking at my HRV, my historical HRV from my Oura Ring. He says, dude, you got too much stress. Wow. He says, you are stressing yourself out. Yes, you're pushing through it, but you need to tap into like a vagus nerve reset, you need to increase your meditation, and you need to do the pulsetto. So I said, well, what's the pulsetto? So I ordered the pulsetto, and this is at the point in time where it's like they had no devices for months. So I'm like itching and waiting for this thing to arrive because I want to see what it's all about. And then I got it, and the first time I used it, I had this unbelievable result where I just felt so like relaxed, And then I started looking at it, and I was like, oh, well, this is not just for this for my stress levels. They got other things for gut health. They have things for pain. So I've used it for all of that. And it has helped for sometimes if I have a little pain in my back, I put the 20 minutes for the pain session that it has, and it really helps. So, the microcurrents, I guess well, I haven't looked into it in detail. I would only assume that it has a specific frequency that helps,
with different ailments and different things going on. Yeah. Interesting. I love that we have all of these tools available to us, but just like you said, there's only so many hours in the day, right? And it's like, okay, how do you prioritize which one to use when and how? And I think it's really individualized, right? Like what do I need today? Right. If I need a reset, okay, I'm going to use a pulsetto. If I need something else, then I'm going to use the red light therapy sauna. And so I think that's really where it's at. But the basics are always in place, which is just walking outside, seeing sunlight, like grounding yourself.
Right.
These are all the easy ones that you can just kind of quickly check off and get done. So that way you can move about your day, with more intention, I think, and
Right.
get more done. What is the one habit that's had the biggest return on investment in terms of your life?
Ooh.
Just one, though.
You hit me with the question.
Yeah.
The biggest return, I don't know if I would label it as a habit, but I'll put it there, is my connection, my spiritual being, right? My connection with God. Making sure that I always put God first, making sure that I pray, making sure that I do go to church on Sunday or Saturday, whatever we decide to go. Sometimes we go Saturday, sometimes Sunday. But that relationship with God is what really gives me the power to do what I do every single day.
Every single day. Yeah.
And the more I'm connected with God, the bigger that return on that investment that I make. Because it's not an investment into God, it's an investment into myself.
Into yourself.
Yeah.
Yeah. And your faith and your belief system.
Right.
Yeah. What's the one thing that you no longer do, or it doesn't serve you anymore?
I'm in a position in my career that I can kind of pick and choose who I bring in my circle and who I really want to, grow and excel with. So before, when I first got it, I started with $500 in my back pocket. So I was bootstrapped since day one. So it's almost like you say yes to everything because you need the opportunities to really scale to the next level. But I'm in a certain point in my career that now I can say no more often than yes. So I think having that ability to be able to say no to certain opportunities and not feel so obligated to say yes to everything has really helped me really zone in on the things that are most important and focus on those to scale them to the next level.
Yeah. It's setting those boundaries, right?
Yeah.
Like where you're like, okay, and I think we all kind of go through this at the beginning where it's kind of, okay, well, I want to be out there. I want people to know. So I'm going to say yes to everything. And then you get to a point where you're like, you know what? I think I'm okay now to say no to certain things. And it's okay. Like, I think at one point I used to feel guilty. I'm like, I feel bad. Like, I feel bad letting them down. And I got to a point where I'm like, no, I think this is what serves me better.
I agree.
To say no.
Yeah. And it really got to a certain stage in my career and in the company's career overall that me saying yes to so many opportunities, the best way I could put it is I was a jack of all trades and a master of none. And I really started noticing like all of these different business verticals that we have within the organization, they're growing, but are they growing at the rate that they should grow?
Right.
Are they being nurtured the way that they should be nurtured? Right. So, and I really did the evaluation on that, and I noticed I was like, it's not.
It's not.
We're actually better off cutting a few things back and then just going all in and making sure that every team that we have, depending on the business vertical we have, is being given the attention that they deserve.
Yeah. That is so, it's basically, that is so true on so many levels. It just means you really need to focus on the core of what it is that you've built, basically.
I agree.
And everything else, you do what feels right and aligned.
Yeah.
Okay. I have some rapid fire questions for you.
Let's do it.
Let's do it. One longevity habit every woman should start before 40.
Getting your blood work done frequently.
Yeah.
Yeah.
I like that. Data. Gives you data.
Yeah.
Yeah. One lab marker every woman should know.
Your hormones.
Yeah. Your hormone panel. Like, we don't talk about that enough. Like, and nobody wants to check it.
Right.
Right. Okay. One health trend that you think is overhyped.
Overhyped. I think some of the fad diets.
Yeah.
You see a lot of like going, keto or carnivore. Everyone's different. So I think some of them are just very overhyped.
Yeah. Remember the Atkins diet?
The Atkins diet.
Remember that?
Yeah. And now it's like the Atkins frozen meals and like, who knows what the heck are in those things at this point.
I can only imagine. Yeah. Talk about being not processed foods.
Right.
Okay. One thing that's completely underappreciated.
One thing that's completely underappreciated. I think one thing that is really underappreciated by a good portion of the population right now is the big movement we have currently, which is the MAHA movement, the Make America Healthy Again movement. I think it's been so politicalized that, regardless of what's happening, if your political views don't align with that administration, you just ignore all of the good stuff that's happening.
Right, right. And there's a lot happening there, by the way. Yeah.
Right.
Yeah. And we don't talk about that enough. A book every entrepreneur should read.
How to Win Friends and Influence People.
Yeah.
Yeah.
I like that. Did you read that before?
I did. Actually, my uncle gave me that book when I was in the 6th grade.
Really?
So I read it multiple times.
Oh, my goodness.
It made me more of a people person and understand people.
Yeah.
Yeah.
Okay. And that's what entrepreneurship is all about, right? It's connections, understanding
relationships.
people. Relationships. Yeah. A leader who's inspired your journey.
My father is really what inspired me into the business world. Him and my mother, they're both architects. And my father had his own firm when we grew up in Milwaukee, Wisconsin. Okay. And I'm the youngest out of 4, so I would always be with mom and dad wherever they went. And my dad would take me in a lot of his like business meetings and things of that nature. And I love that drive. I used to love when my father would just suit up. He's the one who taught me how to tie a tie and wear cufflinks and do all that stuff. So I kind of switched a little bit. I told Dad, hey, I'm going to be rebellious. I'm going to have a little bit more of an urban look, you know. But yeah, my dad always had that drive in him, and I felt, there was a shield that my parents coming from another country in their 30s that they didn't trust a lot of people, right? So I think my dad potentially lost a lot of opportunities having that shield. But when we look at like generational curse or, really looking at your lineage and me taking that baton and moving forward, with the torch, I felt like, you know what? I know I could do what my father did, but I'm going to take it to the next level, for the Tejada family. So, but my dad was definitely a huge inspiration on what I do today for business.
Amazing.
Yeah.
With that, I want to thank you, Sam, for being here today, for spending some time with our audience. And I mean, what a journey. And I'm really excited to have had you and to really, work with you in this space and have so many patients to refer over to you. So where can our audience find out more about you?
Listen, I appreciate you having me. And, it is about all of us working collaboratively together. And this is not just a one-side thing. This is about us coming together. So if anyone's looking for me, they can find me either at liquidvita.com, or you could also, if you want to learn more about me as a person and what I do for the community, the events that I'm at, you can go to samtejada.com. And if you just want to research about me, go to Google and type in Sam Tejada and you'll see everything that pops up.
I love that. Amazing. How many books do you have out, by the way?
So this is my first book that I published, How to Win in Modern Wellness. And I finished my second book, which we finalized the edit. And then I started my third book, which I'm hoping my third book is actually my second book. Okay. So that one, I'm just trying to find time to finish the edit. So the book is done, but now I just have to sit on the beach and really read through it. Yeah.
Amazing. Again, thank you so much, Sammy.
It's been a pleasure. Thank you.
Thank you. If today's conversation resonated with you and you felt seen and heard, make sure that you subscribe, leave me a 5-star review, and share this episode with your friends, your family, a colleague who you think would benefit from hearing this conversation. We need to stop settling for feeling just fine and really start investing in healthier and a longer future for ourselves. I will see you all back next time on another episode of Her Time, Her Health, where I continue bringing you the experts, the conversations, and the evidence-based insights to help you thrive through every stage of life.